Hello viewers, I am Dr. Sanjay Prasad Gupta, a gynecologist. Today let us discuss something about vitamin D and pregnancy. Vitamin D is a fat soluble vitamin and it is synthesized in our skin, so it can be called as steroid hormone also. Vitamin D, so far as we know, is mainly concerned with calcium homeostasis in our body. But recently it has been found that vitamin D reduces insulin resistance, it attenuates the effects of advanced glycation products, it increases the ovulation for abnormal folliculogenesis, it improves endometrial implantation and angiogenesis, and thus it increases the chances of live birth and improves subfertility as well. It has also got role in immune modulation, hematopoietic cells regulation, cognitive function and lung development. So, when there is vitamin D deficiency, there is increased chance of diabetes mellitus, cardiovascular diseases, childhood asthma, reduced fertility and decreased live birth. Now, during pregnancy and the lactation, the fetus takes its vitamin D through placenta, which is transferred from the mother, and the baby gets its vitamin D from the mother through breast milk. So, during pregnancy and lactation, the dose or the requirement of vitamin D increases. Now, what are the sources of vitamin D? Vitamin D is mainly synthesized in the skin by ultraviolet rays of the sun. So, when there is reduced exposure, when there is increased melanin pigmentation or the use of sunblock, then there will be chances of deficiency of vitamin D. And what are the dietary sources? Dietary sources are dairy products, fortified products, fish oil, egg yolk, spinach, banana, mushrooms. All these contains vitamin D. Now, vitamin D is a global nutritional deficiency problem. Its prevalence is very high. It is like an epidemic. In Indian scenario, it has been seen that vitamin D is deficient in 46 to 91% of the cases. Now, what are the effects of vitamin D deficiency in the mother and the fetus? When the mother is vitamin D deficient, then there will be increased chances of preeclampsia, gestational diabetes mellitus, bacterial vaginosis and chorioamnionitis, leading to preterm birth of the baby. There is also in the baby there is reduced growth, low birth weight, neonatal sepsis, respiratory infections, and in the long run there will be childhood asthma, type 1 diabetes mellitus, skeletal abnormalities, neonatal seizures and schizophrenia also. Now, how to diagnose vitamin D? Vitamin D is mainly undiagnosed and so it is untreated. The diagnosis of vitamin D is done by just tasting of 25 hydroxy vitamin D in the blood. When it is up to 30 to 50, we can call it ideal or in the normal range. When it is less than 25 to 20 nanogram per ml, we call it insufficient, and when it is less than 10 to 15 nanogram per ml, we call it deficient. Now, how to treat and supplementation the vitamin D deficiency? When vitamin D is in the normal range or in the ideal range, that is above 30 nanogram per dl, then we have to supplement the pregnancy and lactation with 400 to 600 international units of vitamin D. But when it is insufficient, that is below 25 to 20 nanogram per ml, then 1K of vitamin D is to be given all through gestation and lactation along with 1K of calcium supplementation. When the vitamin D is deficient, that is when it is less than 10 to 15 nanogram per ml of blood or serum, then we call it deficient vitamin D state, and we have to treat with 2K of vitamin D supplementation and 1K of calcium up to 6 weeks, and after that all through the pregnancy and lactation with 1 K of vitamin D and 1 K of calcium. So this is the way we treat and supplement the vitamin D deficient patients. Now, to conclude, there is it has been seen that when we give increased doses of vitamin D, then there are chances of toxicity in the fetus and in the mother because of hypervitaminosis and hypercalcemia and soft tissue deposition of calcium. And at the same time, if we don't diagnose, we don't treat, then there are chances of deficiency of vitamin D leading to its harmful effects in the mother as well as the baby. So all antenatal mother should be offered at the earliest the serum 25-hydroxy vitamin D label. And as per the laboratory guidelines, they should be categorized in ideal or normal range, in insufficient range, or in the deficient range. And as per the category, we should start the vitamin D supplementation or the treatment in right time and in right doses. And what is that? When the vitamin D level is in the normal range, we should give supplementation only 400 to 600 international units of vitamin D along with 1K of calcium all through the gestation and lactation. When they are in the insufficient range, then we have to give 1K of vitamin D supplementation with 1K of calcium all through the gestation and lactation. But when they are in the deficient range, then we have to increase this to 2K, and it has to go up to 6 weeks, and after that we have to convert it into 1K all through the gestation and the lactation period. No need of repeat testing of vitamin D whether it has been normalized or not. So the main thing what we want to know is all the mother should be tested for vitamin D deficiency and they should be treated accordingly as per their categories. Thank you viewers for watching my channel, and don't forget to subscribe to see the further topics on the Gyne and Obs. Thanks again. Thank you very much. Jai Hind.